The opinions expressed on this program are solely those of individual participants and do not necessarily reflect the views of either Spectrum Generations or Time Warner Cable. Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
Here's a health question. What's the leading cause of death and disability in the United States today? You might think heart disease, you might think cancer, but you would be wrong. It is mental health. Today, we're going to talk with two experts in the field of mental health here in the great state of Maine, and I'd like you to help me welcome my guests. First of all, Dr. Karen Mosher, and Karen is the Clinical Director of Kennebec Behavioral Health. Welcome, Karen. And sitting next to Karen is Carothers, who's the Executive Director of the National Alliance on Mental Health of Maine, more commonly known as NAMI.
Correct.
Did I get that right?
Is National Alliance on Mental Illness of Maine.
National Alliance on Mental Illness of Maine. Beg your pardon. Did I get that correct? Is it mental health that is the leading cause of death and disability in the United States?
Yes, mental illness and substance abuse combined are the leading cause. Yep.
How long have you been involved in this field, Karen?
I've been involved in this field for over 25 years. I started as a clinician, and I've been with NAMI for 12 years.
And what is NAMI, and why do we know about it? We've heard about it, and tell us some of the things that you do there.
Great. There's a NAMI in every state.
Yes.
NAMI was founded by family members who had loved ones living with mental illness, and they really wanted life to be better. They wanted their folks to live outside of mental hospitals and have successful lives in the community, and they formed NAMI, and they began to talk to legislators and anybody that would listen. And here we are, it's 30 years later, and there's a NAMI in every state. We offer support, education, advocacy on behalf of all people who are affected by mental illness.
And you're a nonprofit organization.
We're a nonprofit based right here in Augusta, and we have little baby NAMIs all over the state.
You do?
We do.
So how many sites do you have around the state?
We have 20 different places where volunteers offer support groups in those home communities.
Mm-hmm.
Yeah.
Okay, and Kennebec Behavioral Health is also a nonprofit organization. Karen, tell us about KBH.
Yeah, KBH is a private, not-for-profit, comprehensive community mental health center.
What does that mean?
That means that we have a lot of different services that we provide for people.
Such as?
We do outpatient counseling for adults and children.
Adults and children.
Yeah, right.
Any age can...
Right. We have the gamut. We see the gamut in terms of age and also in terms of diagnosis and a level of distress and so forth. So
and how do people come to KBH? How do they do mental health professionals refer them to you, or what's the process, and how does that relate to NAMI as well?
We get referrals from a lot of different places. A number of people self-refer. If they have some issue, they refer themselves. All you have to do is call into and you get our access center.
Is there an 800 number for that?
There is.
If, we'll make sure that we get that up on the screen. So people can call in. They can also go to kbhmaine.org, and that's your website.
That's right.
Okay.
That's right. And there's information on there about how to refer yourself. We get a number of referrals from physicians, from other healthcare providers. We get referrals in different programs from the state, from different state programs, programs for people with mental illness, programs for people who are looking to reunify families who've been separated by the courts.
Mm-hmm.
We have a very broad gamut.
So you have outpatient counseling, is that part of part of what you do?
Yes. Yeah, we do. You know, what we offer what people think about as counseling, and we also have some very specialized services for people with specific and complicated needs.
Now, psychiatric medicine management also is part of the work that you do at KBH.
Right.
What is that?
We have a number of both child and adult psychiatrists and nurse practitioners and physician assistants who basically see people who need psychotropic meds, most often whose primary care doctors are not comfortable prescribing because their needs are too complex. Mm-hmm. And our prescribers see people and prescribe their medication and then monitor how that's working and whether changes are needed.
Now, is there a fee structure for the services that you provide?
Yes.
And how does that work?
A lot of our services are paid for by insurance, but either Maine Care, Medicare, or private insurance. We do have a sliding fee scale for folks who are paying themselves. The availability of, we always keep slots open. The availability of those slots, though, depends upon how much funding we're able to get for them and who else might be already in service with the same.
And I'm sure that the demand exceeds the ability to respond to everything. Yeah.
Always.
Hence the desirability of some of those tax-deductible donations.
Right.
Those are always welcome. Now, school-based mental health services are also a part of KBH.
That's right.
How does that work?
That's right. We have master's level clinicians in a number of school systems in this area where they both consult with the teachers and also see children individually.
Okay, so regardless of age, whether it's a child, an adult, a family facing mental health challenges or substance abuse issues, all of those fall within the orbit of the Kennebec Behavioral Health.
That's right, and a lot of what we specialize in are people and families who experience a number of those issues at the same time.
Sure.
So we have the ability to bring in a lot of different services and coordinate them so that they're working together and people can move ahead on all fronts at the same time.
All right. And Carol Carothers, give me the 411. Give us the overview of NAMI and what kinds of services that you provide to this community, to the state.
Sure. A lot of times I think people don't know where to start. They don't. Something's going on in their family, or there's a child is having some symptoms, they're not doing well in school, the school is sending them home, or you have a loved one who has an illness, bipolar or schizophrenia or depression, and you just don't know where to start. Mm-hmm. So we're a good place to sort of talk through, gosh, what does it all mean? Where might I find the resources in my community? What do you think about this diagnosis that I'm dealing with? What do you know about the best treatment? Really, where can I get help, and what should I be doing as a family member?
Is a reasonable starting place for people to go to is your helpline?
Our helpline, yes, it's 1-800-464-5767, Monday through Friday during regular business hours. And anybody who has any question, we will help them figure out what they might do, where they might get resources, how to understand what their physicians are saying to them, just kind of the basics, how to figure, because I think we're sort of educated about the signs and symptoms of a heart attack. We know what to do, we know who to call.
That's an excellent
But we're
point.
not really, most folks, when mental illness comes into their world, they really have no idea what to do about it. Somebody's acting a little different than they were acting before, and folks just don't know what to do, and they don't know where to get started to
And
look.
it's frightening.
It's frightening. Mental health issues are still very stigmatized. It's okay to kind of say something's wrong with your foot, but most people don't want to say that something's wrong with their minds. It's scary. So we're just a great resource for people to call and find out, oh my gosh, what should I do and where should I get started?
You certainly are a wonderful resource. We're going to talk more about the resource of KBH and NAMI of Maine and how your organizations work together to help serve the mental health needs of the great state of Maine. We'll be back.
There's no place like Hollywood. From the newest slots to blockbuster jackpots and all the excitement you can handle. This is where you're in the spotlight. You're the star. A place where the action never stops and the night is always young. Hollywood, the name says it all.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
Life should be celebrated. It's a special day when family and friends gather together to celebrate the life of a loved one. A celebration of life helps us honor our loved one and keep our memories alive. Whether you're planning a traditional funeral, a creative celebration of life, or a blend of both, at Knowlton Hewins Roberts, we are truly committed to meet the personal and unique needs of you and your family. Knowlton Hewins Roberts. Visit us online or visit our 2 locations in Augusta and Winthrop.
We're discussing mental health and mental illness in the state of Maine with Carol Carothers, who's the Executive Director of the National Alliance of Mental Illness of Maine, NAMI, and Dr. Karen Mosher, who's the Clinical Director of Kennebec Behavioral Health. Before the break, we were talking about the services that are provided at Kennebec Behavioral Health and also at NAMI of Maine, and you gave us the helpline. There is also a whole range of programs that are offered by NAMI. Can you fill us in on those a little bit, Carol, so people are aware?
We have support groups that run all across the state, so think AA Al-Anon. So we run support groups for people who have mental illness. It fosters people taking care of each other and building social networks. And we have groups
because mental illness, and you made this point, that it affects not just one individual, but everybody who's in the orbit of that individual.
Right, it affects families significantly, and so a lot of times families feel confused, it's scary, they don't know how to talk to their loved one anymore, they need the support of other families who are also coping, so we run support groups for families as well.
And you do that in more than 20 communities around the state of Maine.
And we're running at Togus, a group at Togus now as well, for returning vets and their families. Yeah.
Really?
So we have the helpline, we have the support groups. We teach a class called Family to Family. It's families to understand, oh my gosh, what are these medications? What are these diagnoses? Why does the doctor say that about these illnesses? How do I cope? Where do I get resources?
These classes, they run over several weeks?
They run for 12 weeks. Okay. They're off hours, so folks who are working can take them. We're teaching one at Togus right now. Right. But that's also offered all across the state, taught by trained volunteers.
And when these classes are offered, is that posted on your website?
We post it on the website. We try to get a local article in the local newspaper so that folks know about it. Sure. Lots of times folks like from KBH or local providers will refer families to us or refer people to us who...
Are you finding, Carol, that people are taking advantage of these classes?
The one we're teaching at Togus now, we have 15 people, which is, they usually run between 10 and 15. So yes, when we offer the class, they're well attended.
And Karen, as you're talking with people at Kennebec Behavioral Health, do you let them also know, I mean, as nonprofit organizations, you have so many areas of overlap and shared information. Do you find that those classes are valuable to family members?
Oh, absolutely. We refer to NAMI regularly. As I mentioned, it's difficult for people to really understand the amount of loss and grief that they feel when a family member...
And why is that? Tell us about that, Karen.
People expect if they have a serious physical illness like cancer or diabetes, they expect to feel loss and grief because it's such a big change to their lifestyle, and it changes their view of their own mortality and so forth. Some of the mental illnesses change the way that people are able to relate to the folks who they love
Surely.
and who love them, and it can be just a terrible loss.
And part of it, in addition to the grief and the loss, there is also a stigma associated with
It can be very
this.
isolating. Mm-hmm. So I was talking to a Rotary not too long ago, and a dad, and I was just like now, I was talking about mental illness and what it is, and a dad came up to me afterwards and he said, you know, my boy was a big sports star at school and he got depressed. And he said, you know, if my boy had had cancer, every kid on his team would have worn his jersey. But instead, nobody said anything about it.
Sure.
And so mental illness often is very isolating.
And some things are being done to try to reduce the stigma of mental illness. And one of those is Glenn Close has done a public service announcement, and this PSA is, tell us about that.
Glenn Close has mental illness in her family, and she...
The Academy Award-winning actress,
That's
Glenn
right,
Close,
yeah.
yes.
And she just felt that the stigma was just huge. No one talked about it. It was a secret. It was, you know, your loved one was in the hospital because of mental illness. It was a big secret. Nobody brings the casseroles to your house. And she really wanted to do something about that. So she's at a PSA. She started Bring Change to Mind. It's her private organization that's really just devoted to reducing stigma about mental illness.
And people can actually see that PSA. It's on YouTube?
It's on YouTube. It's, if you type in Bring Change 2, use the numeral 2, Bring Change 2, number 2, Mind, it'll show up, yeah.
Bring Change to Mind,
yeah.
And YouTube and Glenn Close, put in all of those keywords and you'd have an opportunity to see that. Yeah. Okay, so you've got the classes going on, you have youth services, and you also have a close interaction with the criminal justice system. Tell us about what NAMI does there.
Sometimes folks are very ill and don't take advantage of the treatment that's available, and sometimes they can fall into the criminal justice system. So, for example, I talked to a sheriff. He said, you know, I have a guy, he got arrested because he was blocking traffic. So he's in my jail for a long time. He was blocking traffic because he thought he was an elephant. So the police officer couldn't get him to move out of the road. So now he's in jail.
Right.
So people fall into jail because they're doing something, and jail is the place where they accept you if there's no other place to go.
Mm-hmm.
So we've been doing we have a lot of involvement with families who have loved ones who have been arrested and are trying to figure out, because now I have to negotiate the mental health system, the substance abuse system, and the criminal justice system. So NAMI's been very involved with helping people understand what to do if they end up in the criminal justice system, and also helping Maine's sheriffs and jails cope with the numbers of folks who have mental health problems that are in the jail.
Sure, so you do some educational work with law enforcement.
We do educational work. We train law enforcement police officers to respond more appropriately. Instead of arresting folks, to divert them to treatment so that they go to the emergency room instead of going to the jail.
So that people know what options are available, because there is a fairly wide network of support groups, educational groups, crisis, intervention, counseling, and information that is available in the state of Maine.
There's lots of help available. I think people don't know where to start, which is why NAMI is there.
Well, we will come back in just a moment. We're going to talk more specifically about how to help people access that information. So, Carol, stay with us. We'll be back in just a moment.
Spectrum Generations. Live healthy, live well. Get answers, get connected. Spectrum Generations, specializing in the art of aging.
There's no place like Hollywood. From the newest slots to blockbuster jackpots and all the excitement you can handle. This is where you're in the spotlight. You're the star. A place where the action never stops and the night is always young. Hollywood, the name says it all.
We're talking with Carol Carothers and Karen Mosher about mental illness in the state of Maine and what services are available. And before the break, we were talking about the stigma associated with mental illness and how it makes it difficult sometimes for people to access help and also for families to cope. The issue of parity, tell me what we mean by that, Carol, because that is directly related to the stigma that you were just discussing.
So before the year 2000, your insurance covered your feet and your hands and your heart, but the insurance coverage for mental illness in all private insurance policies was very, very limited. So most people who had a health crisis, a physical health crisis, would pay $1,500 out of pocket, but people who had a mental health crisis would pay $25,000 out of pocket. So it was just not any, we call it parity because it wasn't equal coverage.
Sure, because physical health was covered at a much lower rate. Mental health
was
issues
covered just hardly, barely at all. There were different co-pays.
10 to 15 times as much.
Right, there were different co-pays, there were different lifetime limits.
But we've now addressed that issue and we now have parity.
So NAMI fought really hard with all kinds of other folks, mental health service providers, to enact a very comprehensive parity law in Maine. So in the large group market in Maine, mental health has to be covered the same way that physical health is covered. And
that's a good thing.
It's a great thing. It really makes a difference. And most businesses will tell you when they adequately cover mental health, really the cost of covering their employees goes down, but the stigma is still there. So as insurance rates go up, and all of us, all employers, the cost of purchasing insurance is skyrocketing. As it goes up and people begin to think about how to economize, they think about getting rid of parity. And so there are efforts in this legislative session to reduce parity in a number of different insurance fronts that we are working hard to prevent.
We have about 345,000 potential viewers of this show, people who might have a very strong interest in making sure that that legislative issue has their opinion registered, whatever their opinion might be. What can a viewer do?
They can contact their local rep who lives in their community and let them know how important mental health parity is and that the science has caught up and we do know that these are illnesses, they're real illnesses like any other, and we need to cover them the same way that we cover all illnesses.
Right. These are illnesses that can be successfully treated.
I mean, I think you've made the point before that we actually know more about how to treat mental illness than perhaps we do some areas of heart disease or other physical illnesses.
Well, I'm not an expert in those areas, but I do know that we're moving ahead and that we are more effective. We do have more effective treatments for mental illness than we had even 10 years ago.
And you write a blog, Karen, and tell us about that, because people want information. They want to learn. One of the best ways to protect anybody's health of any kind is education. What does your blog deal with, and how do we access it?
Okay, my blog it's an agency blog. It's Kennebec Behavioral Health blog. It's called the Dr. Mosher's blog, and what I write about are. I really try to write for the general public. I try to write things for families with children, for people who are looking for to kind of take their lives and their relationships another step or so. I talk there on thinking about how to get to know your children this summer is one of the blogs I did that's still up.
So that whole good mental health interaction with others, families, strengthening that whole relationship.
Families, thinking about family stories and how to use family stories to strengthen your connections.
That leads me, when you're talking about young people, even though many of the people who are watching this show are mature, one of the questions of mental health, of course, has to deal with teen suicide. And I believe NAMI has a program in place to do some screening, because even if you're not a teen, most of us have some of those young people in our life at one level, and we're concerned about them sometimes. It's not easy. I don't think any of us would want to relive our teen years. What kinds of screening opportunities does NAMI make available?
So suicide is the second leading cause of death for young people in Maine. which is higher than the national average.
Say that again,
So
Carol.
the first is accidents, which aren't, it's an accident, not, but second leading cause of death for young people ages 15 to 24 is suicide. And suicide is by far the leading cause of violent death in Maine. So it's much more prevalent than we think it is. And we started a program where we actually, it's called Teen Screen. It's a computerized program. Parents give their permission and then the kids answer the questions. And it's really designed to screen for mental health, substance abuse, and suicidality.
Identifies risk levels
Absolutely.
for them?
Most of us we don't ask kids, how are you feeling? How's it going?
Sure.
And we almost never ask kids if they're feeling suicidal. People are afraid to, oh, will I make them feel suicidal if I ask? And so we screen kids. It's a universal screening tool, and 10% of the kids test positive and they haven't shared it with anybody. They haven't told anybody. These are quiet kids.
What happens if somebody does?
We immediately hook them up with guidance in there, and we also, in the schools where we're working, we have relationships with agencies like Kennebec Behavioral Health. We immediately link them up with treatment or a treatment opportunity, and we talk to their folks about it. Lots of times they haven't shared these feelings of despair with anybody.
So it's an online.
They do it right in the
tool?
school on a little
Oh, okay.
computer, and they answer the questions. Yeah.
So it allows them some degree of anonymity and
Yes,
privacy to do that.
Yeah, it does. Yeah.
Now, are you seeing that kind of an issue also?
Teen suicide is it's such a big issue, and we get involved in it in a number of different levels, the best being prevention. According to a lot of the studies that have been done, the best ways to proactively prevent teen suicides are make sure that you continue to talk to your children, make opportunities for conversation, which is usually best side to side rather than face on. So go someplace in the car together, do dishes together even.
What a good idea.
And, those are things that make a huge difference. And the other thing is have dinner together as a family.
Sure.
At least a few times a week. You know, those kinds of regular communications that kids are used to participating in prevent, at least statistically, prevent substance abuse, prevent suicide. I mean, there are no guarantees, and it's not 100%, but it certainly gives families a heads up.
And it's all interconnected, isn't it? All the areas of mental health. Volunteers are an important part of what you do at NAMI, so tell me briefly how if somebody wants to be a volunteer.
Well, NAMI is a tiny little agency located in Augusta, but we provide services statewide. We have hundreds of volunteers all across Maine who run the support groups. We train them to run the support groups. We train them to teach the classes that we teach. We have volunteers who come in and help us in the office.
Can they contact you directly?
They can contact me directly. We are always looking for volunteers to help us.
Carol Carothers of NAMI of Maine, we thank you so much. People can contact you directly. And Karen Mosher from Kennebec Behavioral Health. Thank you both for being with us today. Ladies and gentlemen, this is an important topic. And if you need help, there are people here to help you, not only NAMI and not only Kennebec Valley Health, but if you are in crisis, here is a number that you can call. 1-888-568-1112. I'm Dot Freeman, Mature Lifestyles. We'll be back. See you soon.
Mature Lifestyle is made possible by Hollywood Slots of Bangor, where every player's a star, and by Knowlton Hewins Roberts Funeral Homes and Cremation Service. Our homes are warm and welcoming, and we take care of you and your family like we would our own. Call us anytime. We are here for you.
You're watching TWC TV, only on Time Warner Cable.